What is menarche? Menarche is a female's first reproductive cycle. This event occurs during puberty, usually around age 13, and continues into the early 50s before stopping. Menarche is caused by an increase in certain hormones from the pituitary gland, mainly estrogen and progesterone. During puberty, the hypothalamus begins to secrete larger amounts of gonadotropin-releasing hormone, or GnRH, which stimulates the anterior pituitary gland to release the gonadotropins, follicle-stimulating hormone, also known as FSH, and luteinizing hormone, also known as LH. These two hormones control female sex cell maturation and the production of female sex cell hormones, namely estrogen and progesterone. Now, estrogen is mainly secreted by the ovaries. During puberty, the anterior pituitary gland causes the ovaries to release increasing amounts of estrogen, which in the case of the menstrual cycle, stimulate the thickening of the endometrium and increase the effectiveness of FSH and LH. Progesterone is a hormone that promotes changes in the uterus during the female reproductive cycle and helps regulate the gonadotropins from the anterior pituitary glands.
Alright, so the main role of female sex hormones occurs with the menstrual cycle. The picture on the right shows the 4 phases, starting with menstruation, then moving to the follicular phase, ovulation, and finally the luteal phase. And we chose this particular image because it does a good job showing how the cycle can vary from person to person. For example, it shows how ovulation generally lands on the 14th day, but can vary between the 12th and the 16th day due to the longer or shorter menses period. These are some key structures to the female reproductive system. The main ones you should focus on are the fallopian tubes, where the eggs travel from the ovary to the uterus and wait to be fertilized. The ovaries, which is the female sex organ that stores eggs and releases estrogen and progesterone. And the endometrium, which is the tissue that lines the uterus. And the uterus, which is the hollow area in a woman's pelvis where babies develop.
While menses is considered the first phase of the reproductive cycle, we are going to start with the follicular phase because it helps show how a new egg changes as it goes through the menstrual cycle. It starts with the secretion of the hormone GnRH from the hypothalamus, which stimulates the anterior pituitary gland to release the hormones FSH and LH. FSH stimulates maturation of ovarian follicles, the granulosa cells of these follicles producing an increasing amount of estrogen and progesterone. LH stimulates certain ovarian cells to secrete precursor molecules that produce estrogen. As a result of the increased estrogen levels, the uterine line changes, thickening the endometrium. As the follicle fully matures, which is around the 14th day of the cycle, it appears at the edge of the ovary as a blister-like bulge. The granulosa cells connect to the inner wall of the ovary, and follicular fluid accumulates. The maturing follicles secrete estrogen that inhibit the release of LH from the anterior pituitary gland, but also allow it to be stored in the gland. Estrogen also makes the anterior pituitary gland more sensitive to GnRH.
The anterior pituitary gland does not respond to GnRH until the 14th day of the cycle, when it releases its stored LH. The surge of the hormones causes the oocytes or ovarian cells within the follicle to complete meiosis, creating secondary oocytes. The LH also interacts with FSH to weaken the and eventually rupture the bulging follicular wall that causes ovulation or the flow of follicular fluid in the second oocyte out of the ovary into the fallopian tubes.
The ruptured space that contained the follicular fluid then fills with blood and clots. These clots form temporary glandular structures called corpus luteum. The corpus luteum cells secrete abundant progesterone and estrogens. The progesterone secreted by the corpus luteum stimulates the uterine glands to release more glycogen and lipids. These provide nutrients within endometrial tissue to create an ideal environment for embryo development.
When a secondary oocyte is released from the ovary and is not fertilized during ovulation, the corpus luteum begins to regress and is replaced with connective tissues. This causes the concentrations of estrogen and progesterone to sharply decrease. In response, the endometrium constricts, reducing the supply of oxygen and nutrients to the endometrium, and causes it to disintegrate and exit the body. This process creates damaged capillaries where blood and cellular debris also pass through the vagina and the menstrual flow. Menses begins the 28th day of the cycle and continues for 3 to 5 days, marking the beginning of the reproductive cycle.
As females get into their 40s and 50s, their ovaries begin to produce less estrogen and progesterone, causing less predictable menstrual cycles. In the subsequent months or years, the cycles stop. This is called menopause. 85% of women reach menopause by the age of 50. However, menopause affects more than just the menstrual cycle. Also, as a result of the reduced estrogen and progesterone concentrations, the breasts, vagina, uterus, and uterine tubes shrink, the pubic and axillary hairs thin, and the epithelial linings associated with urinary and reproductive organs thin. Also, FSH and LH pituitary secretions may continuously be released because they are no longer inhibited by estrogen.
What are the effects of menopause? Due to changes in the rhythmic secretion of GnRH by the hypothalamus from the declining concentration of estrogen and progesterone, 50% of women experience unpleasant vasomolar signs during menopause, including sensations of heat in the face, neck, and upper body called hot flashes. Other women experience migraines, backaches, and increasing levels of fatigue. To combat these side effects, some women take hormone replacement therapy, also known as HRT, to minimize the unpleasant symptoms of menopause. HRT consists of estrogen, progestin treatment, and treatment can come in forms of rings, patches, pills, creams, and gels.
Okay, so what causes infertility? Infertility is the inability to conceive after a year of trying. 60% of the time, an abnormality causing infertility lies within the female reproductive system. Hyposecretion of gonadotropic hormones from the anterior pituitary gland, followed by an inability to ovulate, is one of the most common causes. This inability to ovulate, or anovulation, is found by testing the urine for pregnanediol, whose concentration normally rises in the body following ovulation. If this does not happen, it signals anovulation. Hyposecretion of gonadotropic hormones is treated by administering human chorionic gonadotropin, or human menopausal gonadotropin, two ovulation-stimulating biochemicals. One risk in using HCG or HMG is they sometimes overstimulate the ovaries, causing the follicles to release multiple eggs, which can result in multiple babies if fertilized. Endometriosis, or the growth of the endometrium in the abdominal cavity, is another common cause of infertility. This happens when the endometrium moves up through the uterine tubes during menses into the abdominal cavity. When the tissue breaks down at the end of the menstrual cycle, it is unable to be expelled and causes pain and irritation in the peritoneum. This tissue breakdown also stimulates fibrosis, a condition which encloses the ovary and obstructs the uterine tubes. Additionally, some infections such as gonorrhea cause infertility by inflaming and obstructing the uterine tubes, or stimulating the production of mucus that plugs the cervix, both of which prevent the entry of sperm.
This is a photo of endometriosis, which is one of the primary causes of infertility and is why 1 out of 6 parents have trouble conceiving a child.